It's always fun to see the ticker on the bottom, isn't it?
Agreed. It's already at a 150.
Yeah, it's fun. Give it to 902 tabs and then we'll get started, okay?
Sounds good.
All right, everybody, welcome to our 8th Orthomentor webinar. I'm Bill Levine from Columbia, and it's a pleasure to welcome you all tonight to this special webinar, really geared towards the virtual interviews version 2.0, since we are all facing this again. I'm going to introduce the MC of all MCs, one of the original co-developers of Orthomentor, Tabs Ayer, who is actually relocated from sunny Florida to Baltimore, Maryland. We're not quite sure about his mental status, but he's at Hopkins now, and he's doing great things at Hopkins. Miami is missing him, obviously, and it's great to see Tabs in his new role with a great opportunity for helping medical students at Hopkins and beyond. So Tabs, take it away.
Thank you, Dr. Levine. As always, such a kind intro. It's definitely getting colder up here, so I'm starting to miss the sun just a little bit. I have the biggest honor and privilege of introducing all the individuals who are here with me tonight. And I couldn't be more proud to start by introducing Dr. Cassandra Lee, who's Chief of Sports Medicine and Program Director for Orthopedics at UC Davis in California. In Sacramento specifically. We've got Dr. Ginger Holt, who's actually below me on the screen anyway, so I'll point this way, who is the Vice Chair of Education, Program Director, and Musculoskeletal Oncology Director for Orthopedics at Vanderbilt University. To my left is Dr. Rafi Avidian, who's also a musculoskeletal oncologist and Program Director for Stanford for Stanford University and Department of Orthopedics. And last but certainly not least, Dr. Rajiv Rajani, who is now chair the Department of Orthopedics at Texas Tech in El Paso, Texas, and former program director extraordinaire as well. So first off, thank you to all of you for being here. Couldn't thank you enough. And of course, to my dear friend and esteemed colleague, Dr. Bill Levine, who's always happily answering the questions in the background, and with Chris Codero helping us host this tonight. So, let's just jump right into it. I want to ask each of you, we'll kind of go around the room. We'll just start with Dr. Avidian. Tell me a little bit about the formats that seem to work for you this past cycle, and we'll start with you, Dr. Avidian.
Yeah, thank you. So we took our in-person schedule and just translated that to a virtual format. We did 7 rooms for interviews. We did about 10-minute talking time and then about 2 minutes of transition. And we just scheduled it out so the number of applicants divided by the number of rooms and made it all work just like we would do in a regular in-person setting. And then in the meantime, instead of having a big hall or library where people could hang out, we had breakout rooms where applicants could meet with residents in a smaller group setting, and then our program coordinator, who we're so thankful for, just made sure everything was working and flowing in the background. And I'll stop with that. Obviously, I can add more if you'd like, but I want to give time for everybody else.
That's awesome. And just out of curiosity, what platform did you use before we go to Dr. Lee?
Zoom.
You use Zoom. Okay. So same question, Dr. Lee. What format did you use? What platform did you use? And how were things structured this past cycle?
I think we did very similar to what Stanford did. We basically took our in-person interviews and just flipped them over to Zoom rooms. We do about 7 to 10 minutes per student. And I think each of our rooms, we have different themes, if you will. So, some we look at academics, some we look at research, some look at professionalism, ethics, inspirational, if you will. So we all have different themes for the rooms. And our platform is Thalamus.
Thalamus. Okay. Dr. Holt, same question. What platform and how did things run last year?
Yeah, we same thing. We felt like less variables would be better, and we did a night before. You guys may have done this too. We did a night before virtual format where we did sort of a cocktail hour and let everybody meet sort of an informal setting. So Friday night, and then Saturday morning we tried to do about a 3-hour event. I pre-recorded a video so that we could save time. So we try not to do a presentation. We felt like people were going to get tired on the Zoom, so we pre-recorded a video. It's actually on YouTube, and sent that out, and then did the same thing. We do a lot of rooms and interview people for about 20 minutes at a time. We do sort of longer interviews, and 20 residents, 20 faculty all interview. And in order to show the city, we put a resident on a Segway and had him tour downtown Nashville. It got really cold, and I promised to buy him some better gloves this year, but we sent him around to show various sites around the city, and I'm proud to say he only almost got arrested once. So we're happy that did. Yes.
That's awesome. Dr. Rajani, what's been your experience, and what platform did you use, and what format seemed to work well for y'all?
We used Thalamus last year. It's a little bit of a tricky situation. I was the program director in San Antonio and driving it for many years, and I was transitioning out. So Dr. Ryan Rose really took over, and we transitioned together. We did a very similar format, 8 rooms, which is similar to what we normally do. Decreased the time of the interview a little bit because we felt like being stuck on a Zoom or Thalamus or a video chat when you're running out of time is actually, when you're like waiting on people, no more questions, a little awkward. And we wanted to decrease the amount of time that the students were on the computer, because I think it just feels like it just drags, and it can be very difficult for them. So we did that, and then we had a resident room, and then the night before we would have just the residents gather at kind of like a pre-night get together where they could just have the residents on. And then we did again a little introduction the morning of. I had videotaped a whole bunch of stuff and put together, I think, like a 15-minute video about our program with a lot of our residents and our faculty that we put up on YouTube before to help with the information.
That's awesome. So it sounds like a lot of similarities, maybe some differences in length. One thing I'll just throw out there, and I'll put this to Dr. Vidian first, is what sort of, at least from when you guys thought about it again, debriefed, if you will, as Dr. Levine likes to say to me, what did you find worked well specifically about the way you had it set up? And then what do you think you'll improve upon, especially for this upcoming cycle?
Yeah, I think things that worked well included just, I think, the simple fact that it wasn't that complex to transition from in-person to virtual. And I think, like Dr. Holt said, sometimes just keeping don't try to get fancy, minimize the variables, and that actually works very smoothly. What does, I think we can do better, what kind of worked, we want to do more of, is just the smaller group interactions among the applicants and the either residents or faculty, just kind of more an informal setting. In the end, you have, whatever, name the numbers at 10, 15, 20, is it 8? What's the number where it gets like, you just can't have an informal open discussion on a Zoom platform. So you want to have smaller, maybe more rooms, more small group sessions for interaction.
That's awesome. And Dr. Holt, same question. What things seem to work well in y'all's debrief, and then what kinds of things are you looking to improve upon this coming year?
Yeah, I already mentioned warmer gloves for a resident. Yeah, we felt like we sort of found that the sweet spot was about 2, maybe 3 people in a room to 1 applicant. The applicants felt like and we sort of tried to poll them as we went. They felt like too many people in a room was more like a panel interview, and they found it very difficult to look at the screen and, who are they talking to? And so we want to have maybe 2 or 3 people. One thing our program has going for it is that we have a really good relationship between faculty and the residents. And, how do you show that over Zoom? We really, when people come and we have these social events and we're laughing and joking, but what we did was put them together in a room, and we'd never done that before. We usually do single one-on-one interviews, a faculty and an applicant, or a resident and applicant. And we actually paired faculty and residents and tried to show that. And so we hope that that came across, and that's one of the things that we will do again.
That's those are really, really good points. And I think that demonstrating that interaction is one thing, obviously, are somewhat obviated or is challenging to do, especially in a virtual environment. Dr. Lee, you brought up a really good point about sort of the thematic nature of some of the rooms. Which rooms were sort of most favorably looked upon in terms of feedback you got from students, or which rooms just did well from a sort of a resident / faculty interview perspective as well?
I think in general, we put a lot of, weight in our resident interview room, because they get to see a different aspect of the applicant that we will not, I think the tough part is our faculty. We've tried the thematic thing before in person, and it just doesn't seem to work. We end up kind of talking. When you start talking to someone in person, it goes organically somewhere else. So I think for some reason it worked better in Zoom, and I think the feedback was it was pretty good. So I think that we're planning on doing that again this year.
Got it. Why do you think it worked better? Out of curiosity, why do you think it worked better in Zoom? Is it because it was a little bit more constrained in terms of what you had to talk about, or was it just kind of happenstance in terms of maybe the questions that were being included in terms of specific to those rooms in particular?
I think it's because it was such a new situation, I think, for everyone to try to get to figure out people or meet people on Zoom, that I think everyone just stuck to their script, if you will. I mean, thematics, the script. There wasn't an actual script, say these words, but they actually stuck to the themes much, much more, because I think it was just easier to focus on just getting used to the idea of there's a timer, there's a corner, I'm staring at a camera, that kind of thing. I think it allowed faculty to really focus on just that theme.
That's wonderful to hear. Dr. Rajani, I'll go back to the other question of, what kinds of things did you observe at San Antonio that seemed to work well, and what kinds of things would you improve upon moving forward in your new role?
Yeah, I think the system, I think a lot of people have to remember this came together very quickly last year, and it wasn't as though we had a ton of time. We had a few months, but we didn't have any rotators, right? This year we have rotators, which I think is a big difference for how we're approaching it. For us, I thought that the timing of these rooms was very clear, right? It wasn't like you felt like you were getting shortchanged because it would literally kick you out of a room. And so you felt very like it was a fairish assessment. And I do think I agree with Ginger's point, you don't want to overcrowd, right? Two faculty or 2 people per room is really the max you want. And I thought that was good. Being able to convey information, having a breakout room where you're still with people, I think that's also very helpful. And I'm reading Bill's comments here in the chat, and I'm going to disagree with one point personally. I thought it was great. You got at least some perception of the students through the things that were on their background. I don't like white walls behind people. I think they look insane to me. So things like that, y'all may feel differently about that.
Well, good to know. So if you're interviewing at Texas Tech, don't have white walls in your background, just as an FYI. I want to ask everyone here, if anyone is, and I'll start with you, Dr. Lee, are you interviewing any of your rotators while they're there? Or are you going to do all virtual interviews, including the rotators?
I think we've decided to keep everyone on a fair ground. We actually never have, we've done exit interviews for our rotators in the past, but I think but in general, we've always had, if you come back, we invite you for the formal interview together. So we look at everyone the same way. Once you get that interview, once you come in for those 2 days to interview with us, then everyone's on the same ground, and that's how we decide.
Okay. Dr. Avedian, same question.
We've always interviewed our sub-Is when they're here.
Okay.
Pros and cons, but that's kind of what we've always done. We're continuing to do that.
Okay. Dr. Holt?
Same. We transitioned a few years ago to interviewing them while they were here, and we have done the same thing this year.
Okay.
No,
And
Tabs,
Yes.
the beauty of Stanford and Vanderbilt's approach is that when you do that, that means you don't ever have to tell a rotator that you didn't interview them.
That's fair.
That is fair.
That's the insider tricks right there.
But if you also
That's
set up the expectations up front that, you're not necessarily guaranteed an interview, as long as expectations are clear.
Yeah, and that's what we did. I'd meet the first day of their rotation. I'd tell them we interview about 90%. I got the name and shame on the Excel sheet because I said last year on an Orthomentor that we re-interview applicants, but I didn't have the heart to tell them we don't re-interview applicants that we didn't rank the previous year. That is the only group that we didn't re-interview, but you can't. Sounds, but I think yes, we interviewed, brought everyone back that rotated, except 90%, 10% we did not.
How many people interview at your program? How many people rotate rather in a normal year?
In San Antonio, when I was there, it was about 35 between our home students and visitors, and we had 65-ish interviews total. 6 spots, now 7.
So I want to put out an additional question, which is be honest, in the context of, and this is something I've been thinking about. So if students are interviewing virtually versus kind of interviewing in person, how are we going to sort of level that out to the best of our ability? Obviously, people who interviewed there or rotated there, they had a certain inkling for wanting to, for why they are interested in that institution. But obviously everyone can only do one. And even in a normal cycle, maybe people are doing maybe 3, maybe 4, at most. So how do we, or what sort of measures are y'all taking, especially I'll start with Dr. Avedian, how do you kind of tease that out in the context of, hey, you've got virtual interviewers and you've got these rotators who get to interview in person? How do you sort of level that playing field between those two, obviously knowing that there's some semblance of a difference between the two?
Yeah, I think it's important to note probably from the outset that this is a work in progress. And it's a national debate, it's a debate internally, and so we don't necessarily have the right answers. I think it's just like with any kind of bias, unconscious bias, is just trying to make a system where you bring those biases up to the surface so they're no longer unconscious. So I would say for the some kind of like simple facts is when someone's doing a SubI, by the time they're done with their 4 weeks, the 4 weeks they spent at the front lines with our residents, with our attendings, that's kind of the interview, and that's I think understood by all parties. And so the 10-minute interview, they come talk with me and so forth, is probably just kind of icing on the cake or a minor point that would weigh in. So that's just kind of the way it is. So if you have a SubI opportunity, that's kind of the interview. The second thing is all the rest of the interviews are just going to be virtual. But ultimately, I think it just comes down to just making sure that everyone gets a fair opportunity. Our rank list, the way we kind of do our score sheets, we make sure that we look at everything that somebody's done at volunteer service, their letters of recommendation, and everyone gets a subjective score by multiple reviewers, so that there's no one person that that's kind of may introduce an individual bias. So at least you have two eyes, two set of eyes taking a look.
That's awesome.
Tab,
Yes.
can I just make a comment? I think it's important to separate what Rafi just said, and that is that there's a big difference between interviewing your rotators this year and not, and then the fellowship application process, which is going to be all virtual. And most of the organizations, all the subspecialty organizations, have said it's probably not in our best interest to have some people be allowed to come do in-person interviews and some people do virtual.
Right.
With the fact that we already have this cohort of people that are doing in-person SubIs, they have that advantage of being there already. And I think what Rafi just said is true. It's just like icing. Like, to do that interview in person, you already had the 1-month interview. And so the actual meeting with Dr. Avedian and Dr. Maloney is probably not going to change what just happened in the previous 4 weeks. You either made it or didn't based on that performance, not on how you interview.
And I think that, and that's a really important point. And I think that, that's one of the things I wanted to highlight, is exactly as you said, because again, it does vary from fellowship to residency, but certainly in the context of residency, the interview themselves may vary depending on, again, whether you've been there in person versus, hey, you're exploring the program for maybe the first time. Dr. Holt, just want to kind of ask you that, how at Vanderbilt are y'all kind of teasing out or trying to level that playing field between the in-person rotators and the ones who are going to be interviewing virtually later this cycle?
We always try to make it clear that we aren't going to, even in a regular year, we don't take all rotators. We try really hard to ensure that probably 2 of our spots at least go to people that haven't rotated with us. So it's not a guarantee. And I think, we all know that people can help themselves by coming for an interview. They can certainly hurt themselves by getting to know them a bit better. So we try to do the same thing that we always do. Take a great look at the application, try to get to know the person, whether they're here or not. And again, you have to realize this year too, we can't penalize people or say, oh, you picked your one program to go to and it wasn't us. So, how could that be? I try to tell medical students, our Vanderbilt students this year, to be careful about getting their letter of recommendation from a place they rotated this year, to kind of, be careful about showing that you picked one place over others. But I think we all are reasonable and will be reasonable to start over again. Just because people picked us doesn't mean that we're right for each other. And I think in realizing that, we open it up and go for the best. Anybody we can go from Bill Levine, we do.
Those are great points, and I want to transition now to sort of part 2 of what worked well specifically from the student perspective. And I'll ask Dr. Lee this sort of first question. What facets of the interview setup, whether it's lighting, whether it's the connection, whether it's even the appearance, were optimal? What sort of stood out from the Davis perspective that you can share with the students listening tonight?
I think it's just learning the whole etiquette about how to do a Zoom interview, right? So this is, I think, what we were talking about, how some of us don't necessarily agree about a background. You can have you can have a nice clean room, have a nice white background. If you have something that boring, I'm sorry, I shouldn't say boring, because I'm not trying to tell you that's boring, but go ahead and, spice it up a little bit. I think when I was, so I had to record something for our med school, and I said, look, if you're in an office, have a nice room that's going to be quiet. If you have a kind of desk setup, just put a plant behind there, put something back there that might actually capture some part of your personality, make it a focal point or whatnot. I think lighting is always important. Do you have to have, studio lighting? No, you don't. Just as long as it's, I'm in my office, my lovely fluorescent lighting right now, and I think it's fine. You also want to make sure that your connection is as good as it can be. If it's at the medical school, go there and go find areas like little cubbies or whatever the little offices they have there, so that you can utilize a better Wi-Fi or whatever. But yeah, definitely do test runs. Make sure your microphone's doing well, and everything's working, all your computer stuff's working. Make sure you're still, dress up like you're going to go to an interview, sit upright, look at the camera, don't talk, don't stare over here even though I'm looking at your face tab, I'm look at the camera, which is really hard to do. And it's kind of like a little counterintuitive, but that's what you want to do. Make sure to have eye contact with the camera, dress and show up like you would for a normal professional interview.
That's a really good point. And actually, for those listening, because sometimes I'm looking away because I'm looking at questions that I'm grilling our panelists with. But the reality is that the more you just try to stare at yourself the entire time, and I hate staring at myself, but the more you try to stare at yourself, it actually will keep you centered. And that's just a trick I've observed over the course of doing all these webinars. So just food for thought. But I think those are some great points. Dr. Rajani, I'll ask you the same question. What facets of the interview setup, at least at San Antonio, and what you expect now at Texas Tech, do you think are optimal for students to kind of pay attention to?
Yeah, I'd reiterate a lot of what Dr. Lee said. I agree with almost principally the same things, which is, again, I just, a single plant and an empty bookshelf, to me, I don't know, I'm not a Stephen King, fan, but I would imagine that's what it would look like if you were imagining his book. So I think I like something behind there that speaks to their character, right? You look behind me, you see 2 pictures of my children there, right? I think it speaks a little bit to me. And I think there's something about the psychology of feeling a connection to someone, right? Because this is what you're ultimately trying to create, is that connection to a program, and the program to feel some connection to you. Now, I'm not saying you want to, you're going to try and coerce them, but there's something about it where you feel like, I remember that person, or I can relate to that person. I can specifically remember the exact student that had a guitar hanging in the back, right? I still remember it a year ago, right? So why is that? Because there was something about it. Now, that doesn't necessarily mean that they got in, but at the same time, there's a connection there.
That's I think that's really, really good to know. And I'll ask Dr. Lee.
I think it's, to have this conversation is great, but I think the reality is you're going to get lots of different opinions on backgrounds. What I wrote down there is taken actually from a lot of social media and interviewing articles that I've read and reviewed for that. So that's not the right answer. That's just one perspective. And you're hearing great reasons why other people might think otherwise. I think that the keys that I wrote down, like, I think lighting makes a big difference. And especially if you have a darker complexion than light, and you're completely, you can't see you, that's a real issue. So you want to present your best face forward, so to speak. You also don't want to have the nostril view. All the tips that I put on the chat box, I think are helpful for you guys. I have a great question though from the Q&A, and I think they were thinking about Dr. Holt. Will you guys be blacklisting students for interviews who had to turn down an away rotation this year since we were only able to do one? Great question. You want to take that, Ginger?
Yeah, I mean, again, I think that you only do yourself harm if you limit the pool. I mean, that's our belief, and go, do your best and be your best.
Yeah, that
We will not. Just to be clear, we will not be blacklisting anyone. I think we
Yeah,
all
no blacklisting.
One program,
Yeah.
we get it. There are reasons why people go different places, and we won't hold against them.
And I think I want to just put this out there for all the students. I know there's a lot of things, because I get asked this a bunch of times. There's a lot of things that are out there that are urban legends, myths, whatever. There's probably a good chance that they're just legends, right? Or maybe it was like that once upon a time and things have changed dramatically. So be very careful in general with what you're hearing from the sources that are out there on the quote unquote dark web, and just be mindful of that, okay, as you're moving forward and thinking about programs, interviews, so on and so forth, especially with ERAS having been submitted. I do want to ask a question to Dr. Rajani. What sort of things, and Dr. Lee was mentioning this, but what sort of things are you looking for in terms of just how the student within this box is conducting themselves, whether it be like they're fidgeting a bunch, like I sometimes do, or whether it's like looking away, as Dr. Lee was mentioning, or even just other things about sort of their mannerisms. What are you sort of paying particular attention to? And then I'll turn the same question over to Dr. Holt.
Yeah, I think what I personally have cared about is this concept of authenticity, right? I want people to be authentic. If it means that they're colloquial in their conversation language, I'm okay with that. But I want them to be authentic. And because at the end of the day, I've always looked at it as this sort of economics quotient that everyone wants to get to their happiest place, whatever it may be. And that means that you should try and go to a program that actually fits you. You're not going to be able to visit a lot of these programs. So what time is it better to be real than this? It's for the programs to do the same. So I think be prepared, be able to carry on a conversation, stay engaged. If somebody asks you something, try and really get to the crux of it. And most importantly, this is easier than in person in a lot of ways, because if you have your questions prepared, which you should, right? You're not caught off guard. You know exactly when this interview is coming. I think having real questions that are not just sort of, well, tell me about your residency, something specific. I think that means a lot to me when somebody has a well-prepared question or two.
That's awesome. Dr. Holt, same question.
Yeah, I think that one thing I miss obviously with Zoom or virtual interviews is the physical presence of somebody, and sort of your charisma, how do you bring that across? So of course, I've tried standing in interviews and sitting. I feel like I like standing a little bit. I think you're a stander, Tabs. I think you like to stand when you know. And so we noticed those things. And I think like Raj said, I mean, I noticed the background. I like to ask people about that. I feel like sometimes people put things in the background to see if you notice. So yeah, I think you totally have to be yourself. And like Raj said, you can't be something you're not, because 5 years is going to bear that out. And so, you know, if you're a leg shaker and you're going to have to shake during the interview, obviously it's a little bit off, you know, throws you off a little bit, but you have to do what makes you comfortable. So if you're a stander, stand. You know, if you're a sitter, maybe it tells us you're going to go into hand surgery, or you know, maybe we can already tell that you're, you know, what your specialty is. We're probably doing 6 things at once, and you know, multitasking and doing everything at once. So
that's wonderful. I mean, you're absolutely right. I am a stander for sure. Like I cannot sit 1000%. It's also so I make myself feel a little taller, you know, just because I'm a little bit on the shorter side. But you know, Dr. Vidian, I'll ask you this question. What questions did you seem to think were most challenging for students? Like that seemed to trip them up, so to speak, or they got nervous about or anxious about?
Yeah, so I actually kind of broke that one down into a few categories, if you allow me to. So one is just, maybe this is like, I'm morphing your question a little bit to like what trips people up, but also kind of tips on how to answer some common questions. So one is going to be just, there's the facts question. Like you get a clinical scenario, here's a situation, what do you think of it? We don't expect students to know a lot of things, but I think if you're going into an interview, you should know orthopedic emergencies, no compartment syndrome, no like a septic joint, open fractures. So you should kind of know what to do with those things if you see them. And sometimes people get slipped up with that, or maybe you overthink the scenario that's being presented, like numbness, tingling. You start thinking nerve distributions and get too complicated with that. But just think about that. Number two, if you've done a SubI in trauma and you say I've done 3 trauma rotations, then you should know trauma when you're in your interview. You should know like not necessarily like fellow level or senior resident level, but just kind of like intern PGY2 level is like base, you know, like how to describe a tibia fracture etching, for example. So just kind of like think about when you go into interview, hey, I did trauma rotations, I better know trauma. Next is research. There's a lot of people who've done a lot of research, a lot of publications, very impressive. When you ask people about research, presenting that in an interview in a succinct manner can be sometimes difficult and people stumble. So you can be very smart and stuff, but if you can't present it in like 5 sentences, then it just kind of starts rambling. So when you do like tell me about your research, pick a project, tell me about your research, tell me about one of your research projects you're proud of. It's like, okay, it should be like maybe a sentence on the topic, 1 sentence on the actual specific question that you're asking, the methods you used, what the results were. I'm obviously just going through an abstract format, but just think of it that way: 1 sentence, 1 test, and 1 tense, and then just how it relates to the general thing. So like if someone were talking about like bone grafting for benign bone tumor lesions, and say, well, tell me about research, you published something on bone grafts. Say, well, we were interested in bone graft substitutes in the treatment of benign bone tumors. So we specifically looked at calcium sulfate versus autograft. And the question was, which one will result in faster bone healing? The methods we used was XYZ. We found, you know, XYZ. You know, ultimately our results are interesting, but we have quite a few limitations, and this is how it relates to literature, and this is what we want to do next. To present that in like in 30 seconds versus like talking about, well, I really like bone grafting, and this is what, you know, go on to like all this like tangents that you can talk about bone grafting and bone tumors, just very concise. So I think that is something I noticed that people stumble on quite a bit, and then maybe that's just kind of refining interview technique. Another question that comes up is what to do with like if you get asked I'm not sure the right way of describing it, but illegal questions like, oh, hey Bill, are you married? Are you planning on getting married during residency? Are you going to take some leave for a honeymoon or for paternity leave, that kind of thing? Those are things you shouldn't really be asking. And what do you do? Like an interviewer, do you feel comfortable saying, oh, hey, you know what, I'm not going to answer, it's illegal. Obviously that from a student's perspective, that's going to be difficult. So think about that. If you get asked those questions, how will you navigate that scenario? I guess we don't ask that question, so I haven't really noticed that but I think that in conversations with folks, do you make a joke about it? Do you just kind of side skirt that? The flip side is if you do bring up like, oh yeah, me and my partner are going to be moving, if you bring up the topic, then it's fair game. You may get asked about it. So be prepared for follow-up questions about that. Again, I don't think people are going to be peppering you about that, but it could come up. But I'll pause there. I guess, well, before I pause, the last category would be just the random questions that sometimes people get from an oddball interviewer. I don't know how to answer that one. I think we could go around the room and talk about funny questions or difficult questions that people have had. But those are my tips for the moment. Thanks.
Hey,
That's awesome.
Tabs.
Hey, Dr. Levine.
Yeah, a question's come up a couple of different ways, and so I'd like to address it. Dr. Holt mentioned something about the letter of recommendation from an away rotation, and she gave a very specific point of view, but I think it would be appropriate to hear others' perspectives on that, because there are many students who are saying they've been encouraged to get letters from their one away rotation. So can we get some different thoughts and perspectives on that, perhaps?
Yeah, let's start with Dr. Lee, because I was going to go to her next. Dr. Lee, go for it.
I think that's, so I would say, like, if you are actually going to be able to give to an away rotation, I would actually suggest getting a letter of recommendation. Reason being is that it shows that you're adaptable, you've met different people, you can, they can speak to what kind of a worker you are as opposed to your own home program. So I think having a different perspective is a good thing.
Dr. Rajani?
Yeah, I mean, it's sort of like this thing where I agree with Dr. Lee. It's like we're all looking for data points. And one data point is, well, your homeschool has a vested interest in you doing well for a reason, right? Because that's the other personal gain. But if somebody else outside, it sort of like validates you. It's like kind of like this concept, well, somebody else can tolerate you, so you must be okay, which people tend to say about me with my wife. So it's kind of the same concept.
Dr. Avidian?
I may have a little bit different take on it, not dramatically different. I think the points brought up are valid, but I think people ask that question, I come back to the basic. Get a letter from people who know you best. The best letter is, I've known this person for 2 years, XYZ. I'll take that over like they were on our service for a month as a visiting student, because who knows, maybe the vested interest for Dr. Rajani is a student that he knows he's not going to get along with. He wants him to come to Stanford or vice or something like that, So that's kind of
he didn't deny
that's
it.
my take. I guess it's just one thing, just people know you the best. If you don't have a lot of letters from your home institution and you feel like you can get a strong one from away, great. If not, don't worry about it.
Yeah, Rafi, I'm with you 1,000%. What I tell students all day and all night, you want the best advocates for your application. And the worst letter is from famous person, from famous program that gives you the one paragraph, vomitus of their CV, and they don't even know you, and they didn't spend any time getting to know you. That letter is worth this. So just ask yourself, the best letters are usually for students. If you guys want a little clue, the best letters are those where the faculty member says, Cassie, you were a phenomenal student. I'd love to write you a letter of recommendation. First of all, that's worth its weight in gold. So if you find those, terrific. The second letters are, the best letters are, listen, Dr. Avidian, I've been working with you for a while. Would you feel comfortable writing me a strong letter of support? And hopefully Dr. Avidian is going to be honest with you. We understand sometimes the faculty aren't always honest, but usually you should have good situational awareness to be able to know that you're asking somebody that A, you think is going to be able to write you a strong letter, and B, when you see their response, you can kind of get that, yes, that guy's going to write me a strong letter. But the famous person who doesn't know you and didn't even have a cup of coffee with you is worthless.
So I would say that's the biggest issue for me too, is we know our students right now, we're rotating with them 2 and 3 months at a time. And I couldn't agree more that I would rather have a great letter from anyone that really knows you and can speak to you than, you can tell, we know enough that names versus deep connection and important content is far better to get.
But
There's
I think
there's a really interesting question in the chat as to and I'd love to hear what your take is, but what about letters from outside of ortho, right? So especially last year, I think with the pandemic, I think, doing sub-Is were very limited. So, I mean, there's definitely letters from, family practice and general surgery, but I mean, what are our takes on letters outside of ortho?
I personally prefer, we're talking about a specialty that requires physical skills, hand-eye coordination, and I think I prefer a letter from someone who can speak to that. I think you can get enough character letters, and unless it's something extraordinary or someone you did 7 years of research with, I know my preference is someone who can speak to every aspect of someone as a surgeon. I'm interested what others would say.
Yeah, I'll just chime in with the following, and I'll answer both in one fell swoop. I think, and for the students listening, I think regarding the letters from and away, everyone is speaking the same language, okay? So letters of rec, so as I always suggest to students, don't go to an away expecting to get a letter. You're going to an away to really explore that program. And if you do well, and if the feedback that you can get is demonstrative that, hey, they're willing to write a strong letter from you, those are the people to ask for a letter from. But do not go in there with the expectation that you're going to get a letter. That, I think, is the biggest pitfall, because then, to everyone's point, and to Dr. Holt's point from the jump, you're going to get a letter that's going to be very mediocre. And I say this as a person who had a letter in hand, getting ready to go to my interviews and hand this letter out from the chairman at a really renowned program, who's author of major textbooks, and I opened it. And it was 3 lines, it was horrible, and I didn't even give the letter away. And from that time forward, I'm like, you have to be very careful and be very strategic about identifying who is going to write as much as you can a strong letter. So that's one thing I would just say. So if you can get a letter that you know is going to be strong, wonderful. But to the second point, yes, it should be from people who know you best, and that often is from your home program. That's not to say it can't be from outside institutions, okay? So that's another important thing. Many times, and especially for our osteopathic applicant friends, as well as maybe even international medical grads applying, or folks who don't really have a home program, you may be in a position where you don't have, like the orthopedic folks to write you letters. And I think those are certainly situations in which, non-ortho letters, may be warranted. I've even had some students who reach out to me saying, hey, listen, I've been reaching my letter writers who agreed to write one, but I can't get a hold of him or her. What do I do now? And can I go with someone else? I'm like, time's a ticking. And so I think those are also kind of some exceptions where I think it's not unreasonable to go with a non-orthopedic letter, but orthopedics is always ideal, or specialty specific is always ideal. Dr. Vidin, back to you. Same question to you that was being brought up about non-orthopedic letters from Dr. Lee.
Yeah, I think the one-liner, better to get ortho letters. That's that. If though you've done a PhD, you've spent 4 or 5 years, or a project a year off of in doing some kind of, and it's somebody who's a PhD or MP or something, it's probably worth getting a letter from that person, because they, well, you spent like 4 years with this person, or a year, or have something to show for that. Like if I did my year of like MPH or an international thing, and I've got these publications, or I've got this to show for it, great, you've got that kind of like, I spent the time, here's the fruit of or a letter. But generally speaking, ortho, I think letters mean more.
Dr. Rajani?
Yeah, I pretty much the same with everyone. I absolutely would reiterate the short, terrible letter or mediocre letter sinks people. Because again, I think one of the things that all students are aware of is that this is a pretty competitive pool in general. And when you have in your application a very mediocre comment, it brings in some level of doubt, especially when you're not going to have as many opportunities to express who you are in this whole virtual world compared to in real life. So, and again, I think we've also, last year, we decreased the number of letters that were required, and I'm not sure about the most recent data. Are we still doing 2 or 3 letters? So I think 3. Yeah. So I think, some places in the past had 4, but in general 3, you're probably going to end up with maybe in a way rotation letter, maybe 2 from home. But I agree with you, Tabs. There are students that come from all sorts of different backgrounds that won't necessarily get those. And I think it probably offers them somewhat of a disadvantage, but again, do your absolute best. More important to get an absolutely stellar letter.
Tabs,
Yes.
question about the gamesmanship, and if I get a West Coast letter, does that scare away East Coast programs? Guys, you just can't overthink this. You got to get the best letters you can from the best people you can who know you the best. If you're from an orphan program, we know you're not going to have orthopedic surgeons. Maybe you get one, and that'd be terrific. If you're at a home program with a strong orthopedic pipeline, yeah, you're going to have them all be orthopedic surgeons, all from your school. That's okay. So don't overthink this. Don't try to get into the, I've got to get the West Coast. You know what? There's just too many variables for that. You guys can't control any of that stuff. So put your best foot forward, get your best advocates for you, and hopefully that will serve you well. There's been a lot of questions, guys, about, well, first one question just about technical glitches and how to handle the typical things we are all going to experience in version 2.0. Any words of wisdom? Simone, who's actually doing her SubI here with us right now, just asked that question on the chat box.
We had a technical where the video failed out for a couple of people. So we had the phone numbers readily available. We called them on phone, continued that process.
Yeah, that's what we did. I think the big thing is to not panic. People will make sure that you get your time, and we're in the same boat that you are. And we've all, I still make the rookie Zoom mistake and mess something up. So again, I think kind of to Bill's point, like be reasonable, don't overthink it, because we're all quite reasonable people for the most part, and know that glitches are going to happen.
Dr. Lee, I actually want to ask you this question before I forget. What questions, like what attributes of students seem to be the least impressive during the interviews? What was like, that's going to be a problem? And then I want to go around with everyone to kind of answer that.
Thanks for the hard question.
No, you're welcome.
I can't just say agree with above. Okay.
Yeah,
Make it good so we can say that though.
Right.
I don't know. I think it's really hard. I mean, I think just someone who doesn't seem like they've prepared for their interview, like if we ask questions like, and you don't quite remember what your research project was on, and that's what you claim on your CV, then that's kind of a negative factor, right? So, and I think Bill kind of mentioned this earlier, just like be your authentic self. If there's an incongruity in your story, then we can pick it up. I would assume it's one of those, just be yourself. And I think the hardest part during the interview process is understanding that we're looking for fits of the program. This is not a judge of your character. And so if it doesn't click with a program, it's not that you're a bad person, you're a bad applicant. It's just that wasn't the right program. I know that's way easier to say right here where we're sitting, way easier, but I think that's what I would have told my younger self when I was applying, was like, don't take it personal, just go with the flow and understand that, the right program will click and you'll see it and you'll feel it.
That's a wonderful answer. Dr. Vidian, same question. What attributes kind of stuck out maybe that were least impressive this past cycle?
Yeah, I think an answer that has kind of an actionable item would be the person who kind of rambles with an answer to a question. I think we all do, this human tendency. Think through, like, questions that you might get, think kind of concise, be yourself kind of answers, and then have a way to just kind of stop and then turn it back over to the interviewer. I mean, it's not horrible when applicants do that, but that's kind of a tip there. And then I would just agree with Dr. Lee, like if there's something on your application that you don't know, that's another one. And then third would just be if you're asked like a question, like a clinical question, or and you just kind of start trying to go in circles rather than just saying, I'm not quite sure I know the answer to that one, and then done, kind of concise. And if it's an ethics question, we've had people kind of like in one answer just kind of go from doing like, I would do this, but then I would think maybe I'll do that. And then you kind of go around with your ethics. It's like, well, if you're asked kind of an ethics type of question, think about what the right thing to do is from your perspective, and then kind of stick with that.
So I'm gonna pass this sort of my next question to Dr. Rajani. With this in mind, kind of hearing some of these attributes that may be less impressive, what can students do moving forward to prepare for the interview? You know, obviously the virtual world is a totally different, you know, ball game. Some people just ebb and flow with it, but some people really struggle. And I think that's what, you know, was the dagger for many folks this past cycle who were amazing on paper, but didn't match. So how do students prep for these kind of interviews to combat some of the issues that were mentioned before?
Yeah, so just like anything in life, practice it. And so starting off, the simplest thing is the technical aspects. Make sure your computer, all that works, right? If there's a practice session to say, hey, we're warming up to make sure this modality works on your computer, do it, sign up for it, do it, make sure you're on. It's sort of the old adage, if you're not at the dinner table, you're on it. So be present. That's one. Two, practice with somebody who's going to be honest with you. I think oftentimes we practice with people that already like us despite our flaws. And I think you need to find somebody that likes you, but at the same likes you enough that's going to tell you, hey, this doesn't actually look good. This doesn't come across the way maybe you're thinking it's coming across. And get that feedback and have practice interviews. Med schools are, I'm sure, clamoring to offer this to you as an opportunity. One thing that I wanted to say kind of in the last element that is an absolute no for any interview, and I hopefully people take this advice, never disparage someone else or another program. That is to me a very, very red flag. When you see students that say, well, I don't really like my home program because they don't do this, they don't do that. Please do not do that. So that is a piece of advice I'd offer you. But I think those are kind of the big things. Practice, get somebody to do it with you. Your med school is going to give you that feedback. Find people around you that are willing to listen to you on a virtual set. Make sure your audio is coming across clearly. I have no idea if mine is right now. It could be coming across. I'm completely unclear.
Those are some great responses. And you know, one question I want to ask Dr. Holt in particular is, how do we, you know, for students who may be more reserved, and I think this was something that really became amplified this, you know, with the virtual interview, how do folks really embellish themselves? How do they kind of humbly brag, if you will, about their accolades? And how do they kind of exude that sense of confidence that we're often looking for in future surgeons? So what sort of tricks would you suggest for your students and ones applying this cycle with regards to the virtual interview?
I mean, I have to go with sort of what Raj said, is to practice. And if you know that about yourself, record yourself. Look at how you look. That's one great thing that you can do with Zoom that we're all able to do. But you cannot practice enough. If you're a shy person or a person who, you know, you can't be overbearing. And I think that one thing is being sure that you sit close. You know, there are studies that show how close you are to the camera and how leaning in you are is important. When you're in the group sessions, try to do something to kind of make yourself known, ask questions. And as the point has been brought up, ask good questions. Don't just ask questions for the sake of questions. But if, you know, you can show a deeper interest, you can ask a better question. You know, don't ask the typical, what changes do you expect to come in your program in the next 5 years? You know, ask great questions like, what are the top 5 applicants that came from, or residents that came from your program look like? What does the best resident leaving your program look like? You know, ask great questions because that's really how you're going to stand out. I think that's one thing that you can change or alter. If you're not being asked the questions, you ask them yourself. You know, the one of the great things about interviews is that you come across better in an interview if you ask more questions than you get than you answer. So be ready to ask a lot of good questions.
That's a great point. And I would also encourage students to be very thoughtful with how you craft the question. So that way you're not coming off as being patronizing, or you're not coming off as being like arrogant either. And so even when you're practicing with faculty like mentors or residents, you know, they can also kind of, just as, you know, Dr. Holt and Dr. John, you're saying, kind of be that gut check for you in terms of making sure that you've even practiced those to some degree. So again, they can be thoughtful questions, but, you know, asked appropriately. So that way you're not going to inadvertently irritate the interviewer and then, you know, kind of get a, you know, weird mark as a result. So it's not to say that any question is off, you know, all questions are fine, but just think about how you want to ask them so it doesn't come off condescending in any way. Dr. Levine.
Yeah, especially for students where you're very comfortable and well known in a program. You've done a year of research, You've got great relationships with faculty and residents. There's sometimes that too comfortable line that is crossed by students in that situation at their home programs. And it doesn't mean that you have to be completely, vacant or distant, but I just caution you to watch that fine line in that scenario. I've seen that too many times. Tabs, I'd just like to ask you, because I know we're getting close. You and I spoke to at least 50 students that didn't match last cycle over last year. Many of them, they were amazing students, but I would say probably suffered because of the virtual interviews. So can we spend a couple of minutes? I know we've been trying to get at that a little bit, but can we just spend a couple of minutes on what pearls do you have and what pitfalls did people have that maybe cost them the ability to really shine in this extraordinarily artificial world that we're living? Thanks.
Yeah. I'll just chime in very quickly, and I want to hear from the rest of the group because it's such an amazing panelist group here. I think the biggest thematically across most of students, many had the paper application, but many were passive in terms of their engagement with programs, not taking advantage of virtual opportunities, whether it be rotations, whether it be social engagements, whatever. And I think in some way, shape, or form, that did them a huge disservice. And in some research that Dr. Levine and I have been working on, we've seen this as part of that. A second thing is that I don't think that the students themselves really practiced enough in terms of this virtual engagement, just thinking that, hey, whatever it was in person was going to translate to how it was in how it was going to be in the computer. And I think for those who are, as we talked about earlier, more reserved, that sense really got amplified. And even one of my students here from Hopkins who was in that situation was describing to me, he was like, yeah, I'm kind of reserved at baseline. And it was a lot more awkward pauses, as Dr. Rajani mentioned earlier, than I was hoping there would be. And so a lot of those physical cues are gone or obviated. So that's something I think practicing is really critical. And then the third thing that I spoke to students about is the advocacy piece. No one, and I would not say anyone, that's a phone call from Dr. L or anyone on this panel to me is not going to guarantee anyone's match to Hopkins. Okay, it's just not going to happen, right? But a phone call from me to anyone else, the same thing is not going to happen. But what I will say is, it is the icing on the cake when you hear from someone who you know, respect, and trust. For the same reason why the letters of rec that are out there, if they're coming from people who are willing to just sort of really gush about you, it's going to go a lot further for you in the process than from a person who barely knows you. So I think that's where the advocacy piece was probably the other third missing thing that I observed across the board. Dr. Vidian, same question to you.
Yeah, I think honestly, I don't know if I have the right answer or anything to add. Is not the right answer. It's a tough situation, tough spot. I've thought about it. I don't have much insight to add to what Dr. Iyer said. I say if you have it matched, something that can be helpful for the following years, if you can stay on as a student with student status so that you can do a SubI or something like that, that can be very helpful. Going into the lab and doing research and publishing more papers, I don't know if that necessarily helps you or not. But that would be my comments.
Dr. Lee?
Yeah, I don't think I have anything to add. I think the only thing is maybe if there's a way to improve your application somehow, right? So, it's one thing if you interview badly. So that is where practice comes in. And I love what Ginger was saying about get on Zoom, record yourself. It's like what they tell in public speaking, call yourself and leave yourself a voicemail. Same thing with Zoom, just go ahead and record it and see what you look like and see like, would you hire you, and what you can do to try to improve that. But I would say like, if you didn't match this cycle, the other thing is look and see what you can actually improve in your application. And like Dr. Vidian said, like if there is a way that you cannot graduate med school, that's great. Obviously we're a little bit further in the passage of that, but in that time you can potentially, add a year off for research opportunities, or, you can't change your grades, you can't change your board scores, but whatever you can do to improve your application.
Dr. Holt?
I mean, I would say for now, if you don't, if you aren't at the table, I kind of like that, Raj. If you aren't at the table, you're on the table. But if you aren't getting an interview, you're not even in the door. So some of the questions have come up. I mean, I think the earlier the better, the sooner. I hate it when we've set our interview list, the interviews go out, and then someone calls me and I'm like, what can I do? I mean, we're done. So, having people calling out, I have a stack of emails on my desk that I'm getting from people about students who are interested. And I don't, you don't want to send an email to 150 programs and write the same email and then make the mistake of putting, Dr. Rajani to me. And, we've all seen that happen. But really being honest and being forthright for people and having them contact someone early. Like I say, I'm getting emails now that people are interested in the program. And as the applications are getting ready to drop, those are going to stick out. Those are going to come to mind. I've got a list of people I've been emailed about and been called about and talked about that I'm going to have my eye on and look at as things go ahead. So I would say now's the time to get some calls in, some emails, and try to get your name in there. Because if you're not interviewing, you're out.
2 minutes, Tabs.
Yeah. Dr. Rajani?
Yeah, my view is very similar. There's 1,000-ish applications, and all program directors and interview committees, when they're looking through all this, you're trying to, using this thing to kind of sift out who's going to end up in your basin, right? And not everyone that maybe should get an interview somewhere does. And in a sense, like if I'm here in El Paso, and I think some people don't even know we have a residency here. But if you had a tie to Texas or Southwest, reach out. I think you're never missing out by saying, here's your reason why. Don't just say an email, hey, I'm interested in orthopedics, I want to come here, your program. Have a specific reason as to why. And I think that carries a lot of weight with many program directors.
First and foremost, hey, that was amazing. Everything that's been said tonight has been amazing. I want to, as we kind of head towards the end here, I want to thank each and every one of you for joining us tonight. It's been so insightful, and your advice and wisdom is truly appreciated. Just as I want to go around the room, some parting words. Dr. Vidian, we'll start with you and then go to Dr. Lee.
I take home is be yourself. There's a lot of things here that if you really get in the weeds, you can get really into a rabbit hole quickly. My background, what plant should I put? Should I put a cactus? Should I put a succulent? I don't know. Just, I think the points are taken. Yeah, have a nice background. Don't overthink it. Just be, hey, what do I like? I'm going to put whatever and just kind of be done with it rather than like, oh, I got to get in Dr. Rajani's head. Dr. Holt, what is she going to do? She's from Vanderbilt. Should I get, the right colors or whatever? So take some note of it. Don't overthink it. Take a pause. Don't get in that rabbit hole.
Dr. Lee?
I would say practice the answers. You know what we're probably going to ask. These are interviews. There's standard questions we're going to ask. Practice your answers. Make sure that you're not, just like Dr. Vidian said, you're not going around the bush, kind of going everywhere except answering the question. Just give us a concise question, concise answer, because all of us are going to get Zoom fatigue, and you don't want to be the cause of that Zoom fatigue.
Dr. Holt?
I would say know thyself. As Dr. Lee said, this is a match process. It's nothing personal. We're not going to all like each other, but you want to find the right place for 5 years, and you better know about yourself, try to learn about the program, and really make sure that you're a match. I will say you should be able to answer questions about yourself readily and easily. The worst answer I've ever heard is, I don't know. It's a good time to get to know yourself, think about your values, your favorite book, your favorite movies, that sort of thing. So know yourself and know how to put yourself across so you really have a good match.
Dr. Rajani?
So with that same token, now I agree with everyone before me. And of course, it's easy for me to say, don't worry about what you're going to put behind you when I already made those comments about it. But I think the way I would approach it for students is, remember you're interviewing this program too. And you can't think of it as a one-way street. And that doesn't mean you come across as like, well, you're not good enough, or well, let's see if this program's good enough. I don't mean from that level. This is to be a personality match, right? Come across as authentic, and find out, are you interested in this program? That's your goal. So remember, it's a two-way street.
Dr. Levine?
So my final thoughts for you all are that if you can't be your strongest advocate, how could you expect anyone else to? And along those lines, this whole discussion about, Tabs and I have had a lot of conversations about this advocacy thing. In a normal year, you guys would have done 2 or 3 away rotations if you're not in an orphan program, and your 1 home program. So that was 4 programs that you signaled, using Dr. Bernstein's words, you signaled to those 4 programs, you gave them the rose. Well, this year you only have 2 roses. So that means that there's probably 2 or 3 other programs that you can comfortably say are really your top 5 programs. You can't ask your advocates to call 50 program directors, but you can ask them to call 2 or 3 programs. They don't have to call the place you did your rotation at. They don't have to call your home program because they're there probably. So you're talking about 2 or 3 programs before interview invitation day, because if it's after that, as Dr. Holt has told you, her list is done. She can't add another person so easily or readily. And especially if you guys are couples matching, get on the phone now and get the other program involved now. Dr. Avidian knows I've got a couple of Columbia students that are couples matching. We've already spoken to the other specialties so that they're on board, because he could love our student and they don't know about the couple, the partner, and now you're hosed. So you got to be your best advocate and get your faculty to be your best advocate at your top 3 to 5 programs.
Well, and with that, thank you, everyone. This was a wonderful, wonderful time tonight. Thank you for all the insight and the wisdom. To Dr. Avidian, Dr. Lee, Dr. Holt, and Dr. Rajani, thank you again for joining us tonight. And to Dr. Levine and Chris Cordero from Columbia, thank you as always for hosting. Till next time, best of luck and keep us posted with y'all's progress. Thank you again.
Good luck, everyone. Tabs, thank you as always.
Good luck. Thank you.
Thank
guys.
you.
No problem.
Thanks, great faculty.